Good morning. Today's Arthritis Freedom Thursday. What I would like to talk about today is about rheumatoid arthritis. Can I stop or cure rheumatoid arthritis? My answer to you is that yes, you can stop rheumatoid arthritis, but you may not be able to cure that. We'll call that remission of rheumatoid arthritis. Now, so what is RA? RA is different from osteoarthritis. Osteoarthritis is because the cartilage between the joints wear and tear disappear. RA is caused by autoimmune condition attack your synovial membrane, the ligaments, so they become swollen and huge. The joint becomes a huge joint, and then eventually they calcify, so the joint deformed. So that is a completely different story. It's an autoimmune disease. The causes of RA are not very clear, but it's very important to understand there are a few reasons we need to find out. Number one is because improper diet. Number two is because the stress change the hormone, create a lot of inflammation in your body. Number three is because what? Because the genetic factor. There are genetic tendency. Certain family, they run through autoimmune condition. Number four is the stem cell decline. So the diagnosis for this condition is from X-ray or blood work. Those are the very important way to diagnose that. Then the treatment for RA in conventional medicine, we have very powerful medication to stop the pain. Use a long-steroid anti-inflammatory medication. We can use steroids to suppress immune systems. And also we have DMARDs, disease-modifying agents. So those are the medication like methotrexate. It's a very, very common medication. Or use biologics. That's another group of DMARDs. Number one, Humira, you heard about that. Number two, Enbrel. Number three is Remicade. So those are the very common medication now invented about 15, 20 years ago. They are revolution treatment for RA because they really can stop the progression of the RA effectively. Only concern is that our doctor or your physician will concern about their side effects. So what I would like to talk about today also is how you can stop the progression of RA naturally. Is number one, the diet. You have to find out what food trigger intolerance in your body. What food trigger intolerance in your body? We can do tests on that from your hair, from your blood. That was one thing we'll do. Second, when you make choices, those are the choices you're gonna do. Like a green leafy vegetable. The celery is beautiful, it's great. Green leafy vegetable like spinach is also a good one. Now, you also can use ginger tea when you have when the weather starts changing, you have all those issues going on, then you can use ginger to help you. But the light shades like cucumber, bell pepper, and citrus fruit, you have to be careful about this group of fruits. The second kind of treatment, you're gonna try acupuncture and cupping and herbal treatment. The Chinese medicine has an amazing way to stop the pain, reduce inflammation. It's not as strong as the medication to stop the progression, but acupuncture, cupping, herbal treatment are very, very effective. Next thing is that, okay, you have to work on your stem cell. Like I told you before, you're born as 7 pounds, now you're 140 pounds. The reason you grow from 7 pounds to 140 pounds is because the stem cell in your bone marrow keep you growing. When you reach 30-year-old, they replace the cells. So this is what happened, okay? So your red blood cell, 90% of stem cell in your bone marrow are reproducing your red blood cell, which only survive 120 days. White blood cell, 3 to 5 days. So your red blood cell, white blood cell replaced all the time. Same thing, the joint, the inflammation in your joints is supposed to be cleaned up by the white blood cells, and lymphatic cells, and natural killer cells. But Your body is having weird reaction to create an antibody attacking yourself. So stem cell, to correct your stem cell from your bone marrow is the most powerful treatment so far. So what I can prove to you is that number one, we use natural medicine, acupuncture, cupping, herbs, combined with medication. We can control the disease very well and reduce medication. But number two, when we add in stem cell treatment, it's amazing change. So I just give you two of our patients. The number one patient, Jennifer, she's about 45 years old. 45 years old, start having all the erosion of the joints in the fingers, the MP joints, in the neck, and then in the feet. So it's very painful. Now, after she was using steroids and methotrexate, after stem cell treatment in 3 months, she stopped all the medication. 6 months later, she's almost perfectly fine. Now, 6 months later, we gave her another dosage of stem cell. Another patient, her name is Blanca. Blanca is about 72-year-old. She has very typical RA symptoms. The joints all deformed, the knees swollen, like the crane's knee is huge. So she's at the middle and late stage of RA, but we are able to help her reduce 3 of her biological medication. So right now she's not on any medication. She was in wheelchair, she could not walk anymore. Now she can walk, she can cook. So conclusion for today's presentation is that RA is stoppable. Once the joint is deformed, we cannot reverse that. It cannot be cured. It could be in good remission, but yes, you can stop the progression and give yourself a healthy joints and healthy life. If you have any questions, check our website, wemedhealth.com, East Western Medicine, WEMED health.com. My specialty is combined Western, Eastern medicine, and centered therapy to help our patient reverse chronic disease. Have a great day.